How AI is revolutionizing disease diagnosis. How AI is revolutionizing disease diagnosis. Artificial intelligence, AI, is transforming the healthcare industry in ways that were once unimaginable. One of the most promising areas of AI application in healthcare is disease diagnosis. From identifying the early signs of cancer to predicting heart disease risk, AI algorithms are revolutionizing the way doctors diagnose and treat illnesses. In this article, we'll explore how AI is changing disease diagnosis and what the future holds for this exciting field. What is AI? Artificial intelligence refers to the ability of machines to perform tasks that would normally require human intelligence and reasoning. AI algorithms can analyze large amounts of data, recognize patterns, and make predictions based on that data. In healthcare, AI is being used in many different ways, from predicting patient outcomes to identifying new drug targets. But one of the most promising applications of AI is in disease diagnosis. How AI is changing disease diagnosis. Traditionally, disease diagnosis has been a manual, time-consuming process that often requires multiple tests and visits to the doctor. AI is transforming this process by enabling doctors to diagnose diseases faster and more accurately. Here are just a few examples of how AI is changing disease diagnosis. 1. Identifying cancer early. One of the biggest challenges in cancer treatment is identifying the disease in its early stages. Early detection is essential for improving patient outcomes, but it can be difficult to detect cancer in its earliest stages. AI algorithms can analyze medical images, such as X-rays and MRIs, to detect early signs of cancer that may not be visible to the human eye. For example, Google's DeepMind has developed an AI algorithm that can detect breast cancer in mammograms with a higher degree of accuracy than human radiologists. 2. Predicting heart disease risk. Heart disease is the leading cause of death worldwide, but it can often be prevented with early intervention. AI algorithms can analyze patient data, such as blood pressure, cholesterol levels, and family history, to predict a patient's risk of developing heart disease. This can help doctors identify patients who are at risk and take steps to prevent heart disease before it develops. 3. Diagnosing rare diseases. Rare diseases can be difficult to diagnose because doctors may not have seen similar cases before. AI algorithms can analyze patient data, such as symptoms and medical histories, to identify patterns that may be indicative of a rare disease. This can help doctors make a more accurate diagnosis and develop a more effective treatment plan. 4. Monitoring patients remotely. Remote patient monitoring is becoming increasingly common, especially for patients with chronic conditions. AI algorithms can analyze patient data, such as heart rate and blood sugar levels, to identify trends and patterns that may be indicative of a health problem. This can help doctors intervene before a patient's condition worsens, reducing the need for hospitalizations and emergency room visits. It's the future of AI in disease diagnosis. AI is already transforming disease diagnosis, but there is still much room for growth in this exciting field. Here are just a few of the ways in which AI is expected to impact disease diagnosis in coming years. 1. Personalized medicine. AI algorithms can analyze patient data, such as genetics, lifestyle factors, and medical histories, to develop personalized treatment plans that are tailored to a patient's unique needs. This can improve patient outcomes and reduce the risk of adverse side effects. 2. Faster diagnosis. AI algorithms can analyze large amounts of data in a matter of seconds, enabling doctors to diagnose diseases faster and more accurately than ever before. This can save lives by identifying health problems before they become life-threatening. 3. Improved imaging. AI algorithms can enhance medical imaging, such as X-rays and CT scans, to provide doctors with a more detailed view of a patient's anatomy. This can help doctors diagnose diseases more accurately and develop more effective treatment plans. 4. More efficient diagnostics. AI algorithms can automate many diagnostic tests, reducing the need for manual testing and freeing up doctors' time for other tasks. This can improve patient access to diagnostic services and reduce healthcare costs. 5. Improved patient care. With AI, patient care is becoming more personalized than ever before. AI algorithms are being used to analyze patient data to create customized treatment plans that take into account individual NT needs, allergies, and medical histories. This can lead to better patient outcomes and a higher quality of life for patients. 6. Early disease detection. AI algorithms can analyze patient data and detect patterns that may indicate the early signs of a disease. This enables doctors to intervene early, which can lead to better treatment outcomes and lower healthcare costs. 7. Better drug development. AI is being used in drug development to identify new drug targets and design more effective drugs. This can lead to faster drug development and more effective treatments for patients. 8. Improved clinical trials. AI algorithms can analyze clinical trial data to identify patterns and predict outcomes. This can lead to more efficient and effective clinical trials, which can speed up the development of new treatments and improve patient outcomes. 9. Improved medical education. AI algorithms can help medical students and doctors learn more about diseases, treatments, and outcomes. This can improve the quality of medical education, leading to better patient care and outcomes. 10. Enhanced electronic health records. Electronic health records, EHRs, are an essential tool for healthcare providers, but they can be time-consuming to update and difficult to navigate. AI algorithms can analyze patient data and update EHRs automatically, reducing the administrative burden on doctors and improving the accuracy of patient records. 11. Improved patient engagement. Patient engagement is a critical component of disease prevention and treatment. AI-powered chatbots and virtual assistants can help patients stay on top of their healthcare needs by providing reminders